Welcome everyone. This presentation will cover specialty diagnostics for nutritional assessment, specifically focusing on the Organix comprehensive profile. I am Dr. Warren Brown, Clinical Science Liaison for Genova Diagnostics, and I will be guiding you through this review. Our objectives for today are as follows. We will have a brief introduction to organic acids. We'll learn when to consider the Organix profile. We'll identify some important markers in the Organix. We'll review a clinical case and treatment considerations. And we will also discuss the Organix and how to implement it into your clinical practice. Let's start with defining the term organic acids. Chemically, they are organic, meaning carbon-containing compounds that possess acidic properties. They serve as metabolic intermediates in many biochemical pathways in the body, and in this way, they provide insights into things like energy production, detoxification, biotransformation, as well as serving as metabolites of neurotransmitters and bacteria and yeast. When we see an accumulation of specific organic acids, this can signify metabolic inhibition, possibly due to nutrient deficiencies, toxic interference, enzyme defects, or even certain medications. Here is a graphical depiction of metabolic inhibition due to a nutrient cofactor deficiency. This example shows a pathway in the body where substrate A is ultimately converted into substrate C with the help of enzymes 1 and 2. In this scenario, nutrient cofactor requirements for enzyme 2 are missing due to poor dietary intake. As a result, we see an accumulation of metabolite B, and elevated levels of it are detected in the urine. Functional assessment using organic acids provides an ideal way to assess for B vitamin needs. One of these organic acids, methylmalonic acid or methylmalonate, is thought to be, by some sources, a more reliable marker of B12 deficiency than a serum B12 measurement. Organic acids do have a presence in published medical literature. Let's briefly take a look at a few of these studies. In this study, ethylmalonate, suberate, and adipate were utilized to assess fatty acid metabolism, while pyruvate, L-lactate, and beta-hydroxybutyrate were measured to assess carbohydrate metabolism. The authors concluded that women with higher ethylmalonate and pyruvate levels had greater risk for gestational diabetes, and all of these organic acids are found in the Organix comprehensive profile. Xanthuronate is another organic acid produced in tryptophan catabolism, and vitamin B6 we know plays a critical role in the utilization of tryptophan. This study found that B6 deficiency led to increased production of xanthuronic acid. Methylmalonic acid is produced in the catabolism of valine. Methylmalonic acid is converted into succinyl-CoA by methylmalonyl-CoA mutase, an enzyme that's B12 dependent. In vitamin B12 deficiency, methylmalonate levels increase. This study assessed urinary methylmalonic acid levels in diabetic patients with peripheral nerve degeneration and found it to be a useful tool for identifying B12 deficiencies. Now let's take a closer look at the Organix comprehensive and some of the clinical indications for its use. The Organix comprehensive is structured to provide a systems biology approach to the patient's nutrient needs. Assessments on energy production, B-complex markers, methylation, neurotransmitter metabolism, oxidative damage, detoxification, and dysbiosis are all provided within this profile. The fact that the Organix comprehensive provides insight into so many different body systems makes it an excellent choice for a wide variety of clinical conditions. It's often used for mood imbalances, sleep disturbances, myalgia, fatigue, immune dysfunction, as well as nutrient deficient diets, sports fitness, and other medical interventions that might create deficiencies. Nutrient deficient diets might include things like vegan or raw or gluten-free diets, and I often see elevations in methylmalonate in vegan patients who haven't been careful to include vitamin B12 rich foods. It's common to see nutrient depletion in patients who are taking medications as well, things like metformin, which might lead to deficiencies in B12. That's just one of the many examples. Now let's take a look at a clinical case featuring the Organix comprehensive profile. This is a case of a 32-year-old female with a chief complaint of fatigue for 2 years. She had normal workups, which included a blood count, a metabolic panel, a thyroid panel, and an iron panel, and all were within normal limits. She had a review of systems, which included report of occasional loose stools and constipation, and she had been diagnosed with IBS by her primary care doctor. There was an abundance of processed foods in her diet. There were no supplements or medications at the time of the test, and she reported drinking a few glasses of wine each night and staying up very late, typically because she was having trouble sleeping. She also typically ate her biggest meal at night and often skipped breakfast. This is the first page of the Organix Comprehensive, which provides a summary of the results. Keep in mind, borderline findings are within the reference ranges technically, but depending on the patient's clinical history, they may be pertinent. For example, we're seeing a lot of borderline highs here for the energy production markers, which signify that she might have trouble making energy. High findings, listed here with an H, are findings where the marker was all the way outside of the reference range. The metabolic pathways are also mentioned here in the column on the right. Depending on how many borderline and abnormal results are in a patient's report, the summary may expand onto a second page, which is what we see here. Several additional borderline findings and some high findings as well, which we will discuss in more detail as we go through the report. Here we see the first page of this patient's actual results, and many findings here in the 5th quintile, which are borderline high findings. Remember that elevations here might signal inefficiencies in these energy production pathways, and sometimes that's due to nutrient insufficiencies. Elevations of suberate, for example, suggest that there are inefficiencies in fatty acid metabolism, and that carnitine and B2 may be helpful. An elevation in L-lactate suggests that carbohydrate metabolism may require some support of B1, B2, and lipoic acid. An elevation in beta-hydroxybutyrate, which is a ketone body, suggests that the patient's making ketones. Sometimes that can be due to insulin resistance, prolonged fasting, patients consuming a significant amount of alcohol, and those may be reasons for an elevation of beta-hydroxybutyrate. However, keep in mind, if you have a patient on a low carbohydrate diet, we would expect to see some elevation in beta-hydroxybutyrate. There are also several elevations here within the citric acid cycle, and many of those conversions within the citric acid cycle happen with the help of dehydrogenase enzymes, which have B vitamin and magnesium requirements. One of the nice features of the Organix profile is that nutrient cofactors are mentioned underneath each heading within the report, and these would be considerations for treatment in order to help balance out the associated pathways. The following page in this patient's report showed that in addition to the citric acid cycle abnormalities that we saw on the previous page, there are more B vitamin needs here as well. Elevations in xanthuronate, which is the tryptophan metabolite we mentioned earlier, suggests a need for B6. Beta-hydroxyisovalerate is a byproduct of the amino acid leucine, and that suggests a need for biotin. Generally, when we see elevations in B vitamin dependent markers expressed in multiple locations in the report, then the need appears to have greater significance. This patient also had an elevation of kynurenate, which suggests a need for vitamin B6. As you recall, this patient was consuming a significant amount of alcohol, which frequently results in deficiencies of folate and B6. Elevations in p-hydroxyphenolactate suggest a need for antioxidant support, and this might reflect poor intake of antioxidant-rich foods or increased oxidative burden. Here's another simplified view of the tryptophan kynurenate pathway, and it's a reminder of how these two biomarkers are used. Xanthurenate and kynurenate both serve as markers for B6 status, and when we see them elevated together, indicates a stronger need for B6. Pyroglutamic acid is an intermediate in glutathione metabolism, and elevations indicate inefficiencies in the synthesis of glutathione. It's common to see lower glutathione levels when pyroglutamate is elevated. Elevated urinary sulfate, which we see here as well, can be a reflection of dietary protein intake, particularly the sulfur-containing amino acids such as methionine or cysteine, or even supplementation with something like glucosamine sulfate or MSM, but we're not suspicious of those here for this patient. We wonder if maybe this elevated urinary sulfate might reflect difficulty in the synthesis of glutathione, which itself is a sulfur-containing compound. We also know that vitamin B6 is a required cofactor for the synthesis of glutathione, so we start to see some of the pieces of the puzzle here coming together. Compounds of bacterial, yeast, fungal origin are created by organisms in the intestines. They are absorbed by the body and then excreted in the urine. They're metabolites of bacteria and yeast. These organic acids can suggest dysbiosis, but they can also be influenced by the diet. And if you have a patient who's consuming a lot of processed foods, diet sodas, berries, polyphenol-rich foods, or even phenylalanine, then you might expect to see some elevations here. For this particular patient, though, she also had gut symptoms, and that should be taken into consideration when interpreting these results. At the end of the Organix report is a page of additional considerations, which lists some of the nutrient needs identified by an algorithm that helps with test interpretation. These may be used as a guide as you formulate your patient's treatment plan. However, keep in mind they don't take into account any of the patient's clinical history. Here's an example of how you might use the page. In this case, we recommended 1 gram of vitamin C and E powder twice daily to help with antioxidant support. We recommended a B complex twice a day to help meet the B vitamin needs, making sure that there was enough B6 in that B complex. We recommended a 10 billion of probiotics because of the issues we saw with the bacterial and yeast metabolites. However, you might consider following up with a stool test instead. We recommended focusing on whole, unprocessed foods, which was different than the processed foods that were found in her diet previously. And we recommended eating breakfast, increasing protein and vegetable intake, and reducing alcohol consumption. We also recommended following up with another Organix profile in 6 months. This patient had some pretty significant issues with gut function, so a GIFX comprehensive or IgG food antibody assessment may be of some more use here. She also reported some stress, and so an adrenal cortex stress profile with the cortisol awakening response might provide more insight into cortisol levels and her ability to mount a response in the morning. We also might consider following up with an ion profile, which includes the Organix within it. The benefit of the ion is that you will also see results for amino acids, fatty acids, nutrient and toxic elements, as well as homocysteine.